Introduction to palpation. Hello everyone, welcome to Medscope. In today's video we will be learning about the clinical examination technique of palpation. Palpation is an essential skill in physical exams that allows healthcare professionals to gather valuable information about a patient's internal structures, detect abnormalities, and assess various bodily functions through touch. Let's dive into the techniques and important aspects of palpation. Palpation is the process of using your hands to examine the body to assess physical conditions. This technique is often used to evaluate tenderness, swelling, lumps, or abnormalities in the skin, muscles, and organs. There are different types of palpation, and in this video we will explore each technique and how to perform it effectively. Before starting the palpation, it's important to properly prepare both yourself and the patient. First, explain the procedure to the patient and make sure they are comfortable and relaxed. You can position the patient lying down, sitting, or standing depending on the area you need to examine. It's also essential to ensure privacy, and that the patient's body is appropriately draped for modesty. Lastly, always wash your hands before and after the examination. Let's start with light palpation. This technique is used to assess surface characteristics such as skin texture, temperature, and tenderness. To perform light palpation, use the pads of your fingers, especially the fingertips. Apply light pressure to feel the surface of the skin and underlying tissues. Move your hand gently across the area to feel for any abnormalities like bumps, lumps, or areas of tenderness. Remember, this technique is gentle, and you're not trying to deeply press into the tissue. Next, we have deep palpation, which is used to assess deeper structures like organs or muscles. Here's how you do it. Use the pads of your fingers and apply more pressure compared to light palpation. If needed, use both hands, one for surface pressure and the other for deeper palpation. Make sure to ask the patient to relax their muscles to reduce tension. With deep palpation, you can assess for things like abdominal masses, organ size, or areas of tenderness deep in the body. Slide 5, bimanual palpation. Sometimes you may need to use bimanual palpation, where both hands are used to examine structures that are deeper or have 2 points of contact. This is common when palpating the kidneys or the uterus. Here's how you do it. Place one hand on each side of the structure or organ. Gently apply pressure to assess its size, tenderness, and consistency. This technique is particularly helpful when examining structures like the abdomen or reproductive organs. When performing palpation, there are several key things to assess. Tenderness. Ask the patient if they feel any pain or discomfort. Masses, check for lumps, tumors, or swelling. Note their size, shape, and mobility. Temperature. Feel for any changes in temperature, such as areas that are unusually warm or cool. Rigidity. Check for muscle rigidity, which could indicate inflammation or other issues. Pulsations. Feel for abnormal pulses in blood vessels, such as aortic aneurysms. Communication with the patient is key. Always ensure that the patient is comfortable and explain each step of the palpation process. This will help the patient feel more at ease, especially when you are palpating more sensitive areas. If you feel any abnormal findings, make sure to report them promptly for further investigation. Some of the most common areas you'll palpate include abdomen, to assess for tenderness, swelling, or organ enlargement. Chest, to check for abnormalities in the heart or lungs. Musculoskeletal system, to examine joints, muscles, and bones for tenderness or swelling. Lymph nodes, to check for any enlarged or tender lymph nodes, which could indicate infection or malignancy. Once you've completed the palpation, make sure to thank the patient for their cooperation. If you liked the video, please subscribe. Thank you for watching and see you in the next video on Medscope.